let's move up the chain. Brain mets, bone mets. Does radiation play a role here?
Yes, so melanoma, unfortunately, is a disease when it metastasizes, commonly metastasizes to the brain. And so I see that often. But fortunately, we have good treatments for brain metastases. We have gamma knife radiosurgery here, which is a very effective treatment for each individual tumor that is treated with a very high focused dose of radiation. We also can fall back on whole brain radiation for patients who have more diffuse disease in melanoma. And we also offer hippocampal sparing whole brain radiation with memantine. And this is a particular form of whole brain radiation where we actually carve out the hippocampal gyrus, which is a structure that is sensitive to radiation and which, if we spare it, can help with the cognitive side effects, particularly short-term memory issues. And memantine is a drug that has its approval primarily for Alzheimer's, but we also have a prospective trial which shows a benefit for patients with brain metastases receiving whole brain radiation. And that's another way that we can make the whole brain radiation more tolerable. And then now, since melanoma has been shown to be so responsive to immunotherapy, there's interest, I think, in looking at maybe some hybrid approaches where even if patients have diffuse brain metastases, instead of giving whole brain radiation, perhaps give them immunotherapy and maybe combine that with gamma knife. And that way we can spare them completely from the potential toxicity of whole brain radiation.
So just for the